viewers at home, here again to discuss a little bit about medical law. And so, medical law is an area that touches on the medical aspect of law or the jurisprudential aspect of medicine. Now, we want to know what medical negligence is. Is it the same thing as medical malpractice? Is it the same thing as the normal negligence under law of tort? The answer is this. The issue of medical negligence is above that of normal law of tort negligence because this is for a skilled professional who has been trained as a doctor, as a nurse. We're not just looking at doctors alone, nurses, pharmacists, microbiologists, all of anybody working in a circle of hospital. And so if we are looking at it that way, we want to be sure what constitutes cases of medical negligence. We have seen issues that a doctor that is doing surgery on a particular patient will just leave scrub or needle or knife or something inside the stomach and will suture it. Negligence. Like administration of overdose drug too is also a clear case of medical negligence. Like it happened to Michael Jackson, that the physician gave an overdose of a sleeping tablet and that made him to pass on. He died in the process. Of course, the case was heard in the court over there, and then the man was severely punished and he even paid damages. So that was there must be a doctor-patient relationship, which of course implies that there should be an informed consent before anybody can, if any physician or medical practitioner or health caregiver can administer any drug or anything on the patient. So when we are talking about the doctor-patient relationship, it must be well established that yes, this person truly is a patient of the doctor. Informed consent goes beyond the consent of, oh, look at your hand, oh, this is what is done, what should we do about it, we want to do this. Informed consent goes ahead to tell you that you must even tell the person if there are alternative treatments, if there are things that you can still do aside the fact that if there will be drug to give the person, whether the drugs have side effects, you must tell the person. If there are other alternative drugs that you can also administer, you tell the person. And so allow the person to have one full opportunity of choosing the type of treatment he or she wants. And then, so if there was a particular case, I cannot remember the case often now, that the child had a bad, one of the finger was terribly injured. Didn't cut off permanently, but it was rumpled together. So the mother took the child to the hospital and showed the doctor. The doctor now looked at it, and the doctor told the mother that this finger is badly damaged. That what do you think? And the woman just interrupted him by the doctor and told the doctor that you are the doctor. Please do whatever you think is right. The doctor went ahead to amputate that finger. And later on, the boy could no longer use the remaining fingers to grab things. And the boy now said that he wanted to sue. The boy sued to court, and the court said that the doctor was negligent, that the doctor ought to have informed that boy properly. The doctor's argument was that he informed the mother. The court said that it is the boy, because if that type of boy, I think the boy was 11 years old, the type of boy can always go to a barber's shop to tell a barber that a barber should give him the type of particular hairstyle. So it was expected that he would have been able to inform that child. The child would have been able to know whether he would allow the thing to be amputated in that manner. So that is that about that. Now, issue of negligence borders on duty of care. If someone comes in and you have accepted such a person as your patient, if you are a medical doctor, you have already absorbed the person in as your patient, you need to do everything within your possible care to make sure you care for the person, because you owe the person the duty of care. Now, in the process of doing the duty of care now, you are expected that you should take everything into consideration by asking a person whether there are side effects, whether there are drugs that doesn't really work well with the person. On the one hand, and by at the same time, you should not abandon such person. In the hospital, you find it nowadays, it's very common. A patient will walk in after collecting some money from such patient, they will just abandon the patient there. The patient that is already sick, there was a particular case, the woman was pregnant, they put the woman on the stretcher and they abandoned the woman there. The woman had to turn and she fell on the floor and died there. It was a case of medical negligence. case of Garoro too in the north that gave so bitter and they all died. All of these cases and cases of medical negligence. But it is unfortunate in this part of the world that people don't sue doctors, they don't sue physicians for all these cases of medical negligence because they always give it to God. They say, yeah, it is God that give it and he has taken it. And even if it is injury, they will say it is the devil's work. Some of them don't always believe that they have the right. And if you sleep on your right, nobody will wake you. So it is a fundamental right to health that you should not be injured in the process of trying to get a quality health care. So in other words, when physicians are wrong, they need there to be a sanction that would actually do it. Although they have in their medical code, they have all sorts of things like they can seize the certificate of that type of medical practitioner that has done the negligent act. They can, in some cases too, there could be a bit of imprisonment if the matter is taken to court. But people don't usually do it for the reason I've said earlier. Now, yeah, in a situation where they are severely punished, I want to believe that they will not be negligent. Now, there's something we call contribution negligence. Patients too do contribute to their own to the negligent act. Take for instance, a patient that is supposed to still be on bed rest, but because he wants to go and pick a contract somewhere, decide to discharge himself against medical advice. Such a patient, if he gets home and something else happens, you cannot blame it on the doctor. That's a complete defense for the doctor. That means they have successfully contributed to that negligent act. Even though the doctor is not negligent, the doctor has done everything within his care, but because that one decides to go on his own to go and do it, then it becomes the burden of the negligent act now shifts on the person. So it is important to know that there are a lot of defenses too for medical doctors, in as much as they have done it in goodwill and they have not done it mala fide, that's in bad faith. They have done it out of their good faith. They have done it. Mistakes are bound to happen. It's not all mistakes that necessarily means negligence. You see, because most of the time nobody is infallible. It's only God that cannot make mistake. So doctors do make mistake if it is a reasonable mistake and it is done in a form that it is shown that this truly is a mistake, that any other doctor could have made the same mistake in that same situation, then such would amount to just mere mistake and not in the case of negligence. Now, there's another theory under that says that talks about good Samaritan. When a doctor, a nurse, okay, because we've seen situations like that, accident on the road can just happen, and you see a medical doctor wearing his gloves trying to salvage the situation. That's the type of good Samaritan we're talking about. But in as much as he has agreed to salvage that situation, he must be skillful enough in doing it. Anything lower than that, such a medical person will still be punished. Because he might say that, oh, after all, it was just an emergency. If it's an emergency and he has decided upon himself to go and to attend to it, he must do it dutifully and diligently so that he can avoid cases of medical negligence. Thank you.